Here to discuss the president's COVID-19 diagnosis with us is Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Nice to see you, Doctor.
Hey, Dr. T. Great to see you. All right, so let's break this down, Dr. T. We know the president, as Sharma just said, he's double vaccinated, he's double boosted.
Right.
So in light of that, how surprising is it that he'd be infected? And secondary to that, what are the concerns?
Eddie, let's face it, BA.5 is the most contagious variant yet, and it evades our immunity. So prior infection or prior vaccination is not as great at protecting it. That's why you know so many people that are double vaccinated, double boosted, but are still getting infected. Here's the good news. The president is in good shape because these vaccines are especially good at reducing the risk of severe illness. That's why he's not in the hospital. Another reason that it's less likely that he's going to have to go into the hospital is that he's on the antiviral Paxlovid. That basically decreases the viral load, decreases your symptoms, and reduces the likelihood of being hospitalized by about 90%.
Doctor, the president had a number of close contacts during his trip here yesterday, including members of our congressional delegation. We do not know exactly which variant he is infected with, but given what you know about what's out there and what you just said, what are the chances of spreading it?
It's high, Maria. In the past, with other variants, when you look at household contacts, about a third of household contacts got infected. BA.5 is that much more contagious. It travels that much faster. I'm going to say the risk is about 50%. Those are rough numbers, not exact. The bottom line is the close contacts are at high risk for getting it. Hopefully they're vaccinated, boosted, and if they're at high risk, remember, there's something to do now as opposed to way back when we didn't have antivirals. So if you're high risk, obese, diabetes, chronic heart and lung, etc., immunocompromised, you want to try to reach for Paxlovid, ask your primary care provider, ask your clinical pharmacist. Help is here.
Dr. T, let's switch gears a little bit because in New York State, they just reported the first case of polio in the United States since 2013. They're using the term vaccine-derived case. What does that mean, and what do people need to know?
Yeah, I know polio conjures up some scary thoughts.
Right.
We think of, iron lungs and things like that. The good news is natural polio, the last case in the United States was in 1979. Here's the thing, the polio vaccines work, but the oral polio vaccine, which we no longer use in the United States and haven't used since 2000, it is very effective, but rarely it can cause a reactivation where it becomes a wild type illness in a patient that gets it. But remember, the people that are at risk for this are people who are unimmunized. So I think the take-home message is we are not going to see polio resurgent back in the United States. But if you're a child or if you're an adult and you haven't had your polio vaccines or they're not up to date, you want to talk to your provider to make sure you get them up to date. Again, this is rare. Prior to the U.S. no longer using oral polio, there were about 10 cases per year. Okay, now it's very rare. The last case of this was in 2013 where there was a single case. So again, not something for widespread panic, but just to understand that it's important that you check to make sure you're up to date with your polio.
Always
vaccine.
good to put that in perspective as well. Dr. Todd Ellerin, thank you so much and be well.
Great.